My name is Shemekit. I'm 35 years old. I come from Ethiopia, so I'm here for a treatment. The problem was before 4 months, there was a headache that persistently coming to my mind, and there was a neck pain that's coming to nights, days, and there was a vomiting where I was unable to walk, I was unable to stand. So this problem creates, just very disaster things in my life.
When he had come from Ethiopia, his complaints were severe headache, dimness in the vision, and he was generally feeling very weak, particularly after he underwent an MRI and he was diagnosed to have a brain tumor. So he was afraid, as any other individual would be. So he came to us here at Max Hospital at Spine and Brain India, and I saw him, I saw his reports. We investigated him again in detail. We found out that there was a tumor which is with a cystic conversion of the tumor. We did the eye test to see for the swelling in the optic disc, which was positive. That was the reason for his dimness in vision. And then we decided that okay, we will remove it.
So the investigation has been done within a day, and we met him next day. We met Dr. Saroha next day, and we finalized, we decided how we are going to manage the treatment, how we are going to start the treatment. So we discussed a lot of issues, how we are going to treat this problem, and we decided to remove the mass by operation, and he gave me a lot of advice, like how we are going to make it, how it will going to take long, what is the side effect, what are the positive and the negative effect, and we discussed a lot, and we agreed on that one, and the operation was done on the next day.
If you want to see, you can just see that the incision was quite small incision over the ear, which is within the hairline, and I made a small opening in this part. And then after the removal of the tumor, which was over in about hour and a half, and he got shifted to his room, not to the ICU, and he was very alert, awake, he was very happy, comfortable. So and he started having meals and something to eat the same day of the surgery. The next day he started walking around, and in about 4 days of the surgery he was discharged.
The operation took 2 hours and a half, and it was not this much painful. I was very good. I was able to walk. I was able to speak on the third hour or whatever. So it was very successful operation that we had with Dr. Saroha.
So what I want to say here is not only a case history, but generally what we do with our patients who come from across the world, from various countries in Africa and Asia. We take care of them specifically, personally, so that they feel comfortable, and that is what he would also endorse of.
I would like to recommend patients with the same problem that I will have. I really recommend to come here to Max Hospital and solve their problem with Dr. Saroha. He is a very good professional and to the point and very decisive person, so that you can get relief from it.
I hope we continue to satisfy our patients, and we continue to give good results to the population who is suffering from spine and brain ailments. Thank you very much.
Thank you.